Let's continue our election coverage now. I'm joined live in the studio by someone who's been a member of the House of Keys for nearly 5 years. For 2 and a bit years of that, the last 2.5 years nearly, he's held the ministerial portfolio for health and social care. Good morning, Middleham HK Howard Quayle.
Good morning, James.
Catchy slogan on your website, one good term deserves another. In what way has it been a good term by you?
Well, I think I've addressed the main issues. I think the island faces an awful lot of problems, and balancing the books from the 200 million loss of VAT, as I say, it's widely known it's down to 75 million. I came up with the scheme to have a £50 million enterprise scheme to help local businesses grow on the Isle of Man, to attract new businesses. The easiest way and least painful way of reducing the deficit balance is by growing the economy. And if we can help local businesses expand, that'll be more money into the treasury, and therefore cuts to services or raising of taxes or stealth charges won't have to happen, or they'll have to be significantly less. So I've looked after the big issues, and I've also done an awful lot in the community, in the constituency too.
Well, one big issue, it's confirmed this week that the TT promoter deal between TT to private promoter for running it's stalled, it's not been signed, and the DD Minister Lawrence Skelly, a colleague of yours, said that was partly down to other government departments' issues. What issues has your department got with this DED and Vision 9? Because it seems, looking in from the outside, that they're poles apart.
Right, well, first and foremost, I'd like to say I think it's well known I'm a big supporter of the TT and the Manx Grand Prix. However, as the Health and Social Care Minister, I've got to be responsible for my department. So it's the impact on the hospital, on our ambulance service, on even on our GP surgery. If there's going to be a considerable influx of extra people, there's going to come at a cost. We've got to plan.
That's still being addressed, presumably.
Yeah, who's going to pick up the tab for the extra people that we have to bring over to help run Noble's Hospital A&E department, for example. So all these things need looking at and made sure that it's clear before anything's signed.
The findings of this new government research project were released the other day, covering almost every facet of Manx life. I think it says confidence in government stands at 43%, confidence in the media about 44%. I don't know what that says about us. Confidence in the health service at 61%. How do you remedy that?
Well, we're constantly looking at improving the service, James, and we take this feedback, we look at it. There are other answers on healthy eating, drugs and alcohol, and our public health will be looking at those areas. Our entire management team will be looking at constantly improving the service we give to the people of the Isle of Man. 61% isn't 44%, as the media, as you rightly point out, James, but we'll always do our best to improve.
We're a very untrustworthy bunch, clearly. Tell me, you head up around more than 2,000 members of staff in the department hospital.
About 2,800 full-time.
Right, nearly 3,000 then. How's morale?
I think it's on the up. The feedback, I mean, there's an awful lot more to do yet, James. I think that's an obvious one. But if you look at the hospital, we've got the new nurses' home getting built there. That shows that we're listening to the concerns of nurses. We're training more nurses, and the first cohort of 20 nurses a year that I put in place when I was first elected next year come online. So it's a long-term game in health and social care, but we are seeing the green shoots of recovery and change for the better. But it's not happening overnight.
Managing the liability of public sector pensions, you've been, I think it's fair to say, opposed to some of your ministerial colleagues on this. What's the solution?
Well, I think what's been proposed, the cost envelope, etc., and the additional payments, the reduction in accrual rates, that's a step in the right direction. I've listened to other people, and they've been discussing closing it to the scheme to new entrants. Now, that's all in good and proper, but I think as a backbencher, I described the public sector schemes as a Ponzi scheme. Effectively, they're reliant on the money coming in to pay for those people who are already retired, and given the state of the island's finances at the moment, closing it to new entrants, you're going to lose a significant amount of income coming into that fund, and I'm not sure at this moment in time that we could do that. So what we've done so far, that the changes are a step in the right direction. They reduce the liability growth, but I think more will need to be done in the future.